Hi there, I'm MACROLIDES and I am under central nervous system drugs and chemotherapeutic agent. My generic names are azithromycin, clarithromycin, and erythromycin. My brand names are Zithromax, Bioxin, Eritab, and Eric. I am an antibiotic, which means I fight against bacteria, and I am a protein synthesis inhibitor. My pregnancy category is B. Adequate studies have demonstrated no evidence of risk to the fetus and to the mother. My mechanisms of action. I mainly affect gram-positive cocci and intracellular pathogens such as myoplasma, chlamydia, and legionella. We are bacteriostatic. We inhibit protein synthesis by targeting the bacterial ribosome's 50S subunit suppression of mRNA-dependent messenger synthesis and by inhibition of translocation of messenger RNA. MACROLIDES also inhibits translation of a subset of cellular proteins, and their action depends on the developing proteins, sequences, and on the antibiotic structure. Pharmacokinetics. There are two routes of administration, oral and intravenous. In the oral route, the onset is 1 to 2 hours, the peak is 1 to 4 hours, and on the intravenous route, the onset is rapid and the peak is less than 1 hour. We are metabolized in the liver with a half-life of 3 to 5 hours. We are distributed crossing placenta and enters the breast milk. We are excreted in the liver and the kidney by urine. I am indicated to patients with otitis media, labyrinthitis, sinusitis, tonsillitis, and laryngitis. Patients with pneumonia, bronchitis, and whooping cough. Patients with eczema, psoriasis, and acne. Patients with gingivitis and tooth abscess, and patients with chlamydia. These are my contraindications and cautions. I am contraindicated to patients with prolonged QT intervals on ECG, patients with congenital conditions, patients taking Class IA and Class 3 antiarrhythmic agents, and pregnant women. Now let's go to my side effects and adverse effects. The central nervous system, my side effect is dizziness. In the cardiovascular system, my side effects are QT interval prolongation and ventricular tachyarrhythmia. The gastrointestinal system, my side effects are GI disturbances, nausea and vomiting, abdominal cramps, and diarrhea. In the skin, my side effects are jaundice, Stevens-Johnson syndrome, toxic epidermal necrolysis. In the eyes, ears, nose, and tongue, my side effects are tinnitus and reversible hearing loss. Then others are inhibition of hepatic metabolism. Nursing responsibilities before administering the drug. First is to assess for the mentioned cautions and contraindications to prevent any complications. Then, perform a thorough physical assessment to establish baseline data before the drug therapy begins in order to determine effectiveness of the drug therapy and to evaluate for occurrence of any adverse effects associated with the drug therapy. Then, perform culture and sensitivity tests at the site of infection to ensure appropriate use of the drug. Next is the nursing responsibilities during drug administration. Check for culture and sensitivity reports to ensure that this is the drug of choice for this patient. Monitor infection site and presenting signs and symptoms throughout the course of drug therapy because failure of these manifestations to resolve may indicate the need to reculture the site. Provide safety measures to protect the patient if CNS effects occur. Educate client in drug therapy to promote understanding and compliance. Provide the following patient teaching: safety precautions during lots of fluid, and to maintain nutrition even though nausea and vomiting may occur. Report difficulty breathing, severe headache, fever, diarrhea, and signs of infection. Nursing responsibilities after drug administration. Monitor patient's response to the drug therapy. Monitor for adverse effects. Evaluate the patient's understanding in drug therapy by asking patient to name the drug, its indication, and adverse effects to watch for. Monitor patients' compliance to the drug therapy. We are the MACROLIDES team, and thank you for listening.